Hey everybody, welcome to another week of Dentistry Unmasked. I'm Pam Maragliano-Muniz with me as always.
Hey Pam, David Rice here. Good to see you.
So good to see you and so good to have one of my favorite people with us this week, Melissa Obrotka. Welcome.
Thanks, guys. I'm super psyched to be here. Thanks for having me.
I'm so happy to have you here. So I feel like we needed to, I don't know. All right, you guys, I'm just going to have a therapy session, not like a full one, just like a small one right now. I feel like when I need a voice of reason or I need somebody to like kind of like talk about different things, like Melissa is always like such a perfect person to talk with because she takes different sides of things and like makes sense of it. And as we all know, anything too much is too much. And she can like make something, put things into moderation and make things make sense. And so there's so many things going on in dental hygiene right now that I feel like it's easy to jump on a camp, whether it's like, I'm not going to do fluoride anymore, or fluoride out of the water, or dental assistants taking on hygiene. It's like you got to go to Melissa because you have such an interesting perspective on all of these things. So tell us, let's just start with, what are you working on right now? What's going on with you? And, yeah, let's hit all the topics.
Awesome. Thank you. Number one, thank you so much. You just like melted my heart. I appreciate that. I feel feeling totally mutual about you. Like you and I get on a call to talk about business and we hit so many topics. It's not even funny. But so things that I'm doing right now, I have my hands in a lot of different things. I am a part of the GBT movement here in the United States, and I love being with my GBT peeps right here too. It's amazing. So we are just working really hard to raise awareness and help people understand how biofilm management is the what we need to do. It's not the wave of the future. It is here. It is now, and this is the shift we need as dental professionals to take to really care for our patients. So I work with EMS, with the key opinion leaders and events and coordinating things to that regard. I practice 2 days a week because I could not put my GBT machine down. I absolutely love patient care and I work in perio pros and I love the complex cases. I love seeing patients that, other offices are like, we can't help you. Come go see this practice. So I love being that last resort and we can like get super creative and figure out different strategies and ways to make things work for our patients. And it's like you're entering into this journey. And being in that practice and being with those really complicated cases has helped me shift my perspective from being a dental hygienist and like very much like this person is in this box and this person is that box. Working with Danny Oriana, he's a phenomenal prosthodontist. He has really shown me how to, yeah, there's basic standards that we have to follow, but sometimes we have to kind of think outside the box and get creative. And he's given me the space to do that. And he's also supplied me with the technology to do that. So shout out to Dr. O, love him. And it's been a shift to looking at myself more like coach than like clinician in some aspects, because it's what I've learned over the years, it's the behavior modification that I can help the patient achieve that's really going to bring them to the successful outcome. So I love my 2 days a week when I'm practicing. So I'm doing that. And I also have a podcast. It's called Disrupting Dentistry Podcast. And my partner is in Australia, Tabitha Ackret. So she and I put out 2 episodes per month, and we get to interview amazing people just like yourselves. So definitely want to flip this around and have you guys on our show also and get to do those things. And I do a little bit of speaking and just I have some courses online that I'm offering to dental hygienists who basically just want to practice at the top of their scope and give our patients, like really truly serve our patients and help them understand that their oral health is directly connected to their total body health. And what they're doing here and what they're not doing here is it all matters. So it's kind of like looking at the bigger picture and bringing it together.
I love that, and I love the concept of us as healthcare champions for our patients of patient promises, and of us kind of saying like, hey, here's who I'm going to be for you. And when we do that, Pam, you and I have had the conversation of like, there is no one solution for anything out there. There are times and circumstances and situations. So I love your mindset as you bring this to it. So when you're in practice for a couple of days, like How do you sit back and help shape that mindset for a patient? Because you're right, no matter what it is we do within our four walls, they go home and then it's kind of on them.
Absolutely. So it's changed so much for me in my 20 plus years being a dental hygienist. I've learned to be very curious and ask a lot of questions of my patients and really, motivational interviewing, a lot of open-ended things and just gathering data out of them. So understanding what their motivational drivers are, like, what do you want me to focus on here as your healthcare provider? Is it your health that's most important to you? Is it aesthetics that's most important to you? Is it how your teeth are functioning that's most important to you? Where do you want me to put my focus? And if it's all three, what's the order of importance? And we'll tackle what you want first and we'll, take it along the way. Obviously, if there's an active disease process, we have to shift our focus and get you healthy and take care of that. But I want them to know that they're in control. Dentistry is so, I mean, it's intense, right? People are laying back, they're vulnerable position, their mouth is open, we're sitting over them. There's a lot
Mm.
of things that are very, it's just in a vulnerable place. So I want them to be as comfortable as possible. And I want them to feel like they're in the driver's seat. But then at the same time, I have to flip that around and educate them as well because they don't know what they don't know. Most of our patients have a very low dental intelligence, and it's our jobs to really educate them as to why what they're doing here and what they're not doing here is important.
So you mentioned motivational interviewing and you mentioned a few things, but I think also people need to understand that you didn't just make this up. Like people go and get extra education in motivational interviewing. And also what you touched upon, which was validated at Tufts, shout out to TOEFL out there, um, oral health related quality of life. And it
Yes.
can be dialed down to comfort, function, aesthetics, and the patient's perception of their own health. And it's funny because I feel like the old mentality was, oh, you can't ask patients about how their teeth look. You can't do that. That's selling, or whatever. But I feel like, gosh, like what a shame it would be if, I mean, we did this in our practice back when we were implementing oral health related quality of life questions. What a shame it was when patients were patients in that practice longer than I was alive at the time. They would come in every 2, 3, 4 months. And when we started asking, do you think your mouth is healthy? And they say no. Like, what is going on here? Or do you
Yeah.
like how your smile looks? And they say no. Like, they're literally just like coming in and like getting nothing out of these appointments. And I think one beautiful thing that's come out of COVID is that dental hygienists are more empowered and they know that they have this impact on patients' health. And I think health topics are higher up on our patients' value system. So it's really
Yes.
a nice alignment that we have right now that we truly can get people more healthy. So I know you've gotten some training in motivational interviewing and also biologic hygiene. I know there's these, controversy right now regarding fluoride. Where are you on this? Because I feel like not everybody can or does take the time. I mean, you've got like certification. You guys, you won't even believe how many certifications this woman has. Like it's crazy. And so I feel like not everybody can or like will do that. And so where like what little pearls can we take so we can go back to our practices and really make a difference for our patients?
Sure, I love that. I am certified as a life coach, and I'm actually right now going through certification in neuro-linguistic programming
See, I
because
told
brain
you.
science, it's just fascinating to me. And I'm one of those people, I'm a fact finder. I want to learn, like it's just who I am. So I'm happy to share because when we know better, we can do better. So I think that, to hit the motivational interviewing piece first, we just, everybody has their own internal representation system. And when a patient comes into our practice and they come in and they might have a little bit of an attitude, they might be a little bit off-putting. Typically, we know from the experience we've had that comes from fear, right? So if you create a comfortable environment for that patient and you don't take it personally and you as the provider check your ego at the door, we can ask the questions to really engage into the patient and get to the root of why they have this barrier and this wall up. And, we start to break them down just by asking them questions and having a better understanding. And then when you ask them a specific question and they give you their response, and you have that mirroring technique where you're repeating. So if I heard you right, Mr. Jones, you said that you've had a bad experience in the past. And when the previous dentist did this, you felt this way. Is that correct? And then they're confirming or denying. So now I know what not to do to recreate that situation. So it's trust building, and it's really getting to know them and understand what their needs, wants, and desires are. And then we have that other issue that hangs out in our operatories, and that's, what are they controlled by financially? Do they think their insurance is what is going to be dictating the treatment that we're proposing? Because I feel like a lot of dental professionals too, we opt patients out of even talking about what we're finding in their mouths, in their periodontal treatment, in their radiographs, in their oral assessments, because we think they're not going to agree with our proposed plan to get them healthy, because we know their insurance is not going to cover it. So we also have, we bring our own issues into the operatory a lot as well. So it's really just kind of cleaning up your side of the street and understanding what you're there to do. And we're all in a service-based industry. We're here to serve the patients that come to our operatories. So we have to really come with an open mind and an open heart and follow their lead, but then utilize our knowledge that we have to be able to meet them where they are and lead them where we would like them to go to get them healthy. And I think that a lot of teams don't calibrate on that. I think having team meetings and everybody kind of being on the same page as to what kind of care we're providing is a big piece of that. So then on the flip side of it, kind of like outside of the communication piece, there's just really getting deep into the root cause of the things we see orally. Like, we learn so much as dental hygienists, and I hate hearing this because I've been a professor at Bergen Community College here in New Jersey for many, many years, working with the students clinically. And I hear them come back, after they've graduated, and they're like, we learn all this stuff in school, but I don't use it in clinical practice. And it's just like a knife in my heart, right? Because it's like, but why? Why do you think we needed to learn it? Because we should be applying these things and continuing to have that full body approach. It's a human, not a mouth. And things start here and the whole body is affected. So really digging deep as patients are learning about the oral systemic link, and it's becoming so mainstream in media, we have to support ourselves in that education as well. And you could do that through many different biological associations. There's so many oral systemic courses that are available out there. And even just reading the white papers. I mean, there's so much research inside dentistry, outside dentistry, making these connections that help us, understand it better. So some of the things I would like to do in my practice in the next couple of years is I want to work more with cardiologists, and I want to work more with endocrinologists and neurologists. And I want them to include me in their care plan, because when I'm managing biofilm and inflammation better, I know I can help those patients based on what the research has showed me. So like, that's where I want to see us taking dental hygiene.
I love that. And I think, if you're a hygienist listening here, I I'm imagining you're going like, how am I going to have time for all of this stuff? But we all have the same 24 hours in a day. So it's
Yep.
about prioritizing things. And if you're a dentist listening here, like, understand we have tremendous hygienists throughout our country who do want better. And sometimes we meet those people when they're there. And sometimes it's our job to help develop hygienists on our teams to want to elevate to the level that Melissa's talking about here.
Yeah, absolutely. I think mentorship is huge. And I know, I've been in dentistry for so long. I've done just about every job in a dental practice outside of the actual dentistry that you guys are doing. And it's a lot. There's a lot going on. There's so many moving parts. But I think it's important to remember why we're all there. And that's why I really think everybody coming together in that practice and knowing what the practice owner's why is, and everyone being, very calibrated on that, is such a critical part to really raising the bar and being able to give our patients what we all took an oath to do.
So this is why I always say in my lectures, you got to create a mission and a vision, like a heartfelt one. Like, what is your practice about? What do you want your patients to know that your practice is about? But also, what does your team need to know? Yeah, I think one of the biggest things is that we can be frustrated with one another, but if we never actually clearly defined what we want and what we're looking for, then that's really where I think a lot of these challenges between dentists and dental hygienists take place. So how do you do it? I feel like I do believe, and I know this isn't a commercial for EMS or GBT for that matter, but I feel like the Compass has really created a nice framework for an efficient dental hygiene appointment. So for those who don't really know it, I know we're not going to go through all that, but like, what are your favorite parts of the hygiene appointment where you feel like you can be most effective? Because in my opinion, there's no way it's, I'm really good at my hand scaler. Like that's not what's getting people healthy. What is it?
No. So it's the education. It's absolutely the data gathering and the education and the communication that make the biggest difference. And then to be able to pair that with technology that allows you to do a really amazing, efficient job that's scientifically backed, but at the same time, it's really minimally invasive and comfortable for our patients. That's the whole trust building piece, right? So you can say all these things and be that talking head, but then when you actually go to execute it and it's uncomfortable and we haven't even like given them the white teeth that make them happy at the end of the appointment, we've got a disconnection there. So the thing that I love the most about GBT is that, we get taught ADPI in dental hygiene school to be able to do all of our assessments and execute our care. And GBT is a section. It's basically ADPI, mapped out. So we're able to calibrate within clinicians. We're able to really provide that comprehensive care. But my favorite part is absolutely, steps 1, 2, and 3, because that's when I am doing my number one, my medical assessment. So I'm looking at the bigger picture. I'm interviewing my patient to understand not only their own personal medical issues, but is there any family history? So we know that there's like a genetic predisposition to something. I had a patient that we've been treating her with salivary diagnostics and doing some other adjunctive therapies because she has a family history of Alzheimer's. So, and the funny thing is that because she was just in this week, periodontal charting, 1 through 3 pocket depths, 2 bleeding points in her entire mouth. So we would typically deem her pretty healthy, but her salivary diagnostic, PG and TN, off the charts, absolutely off the charts. So, and the MPG, we know that is associated with Alzheimer's. So what am I going to do now to help reduce this and get this person on a very prescriptive, personalized plan that we can now watch and see that what we're doing is working with follow-up tests. So that's the kind of stuff that like sets my heart on fire. I could scale teeth all day long, but I'll be falling, I was bored. I got bored. And that's what ends up happening. When you hit that boredom part, you start to become either complacent or you're like, I have to do something differently to not feel this way. So luckily for me, I got exposed to really advanced prosto and implant cases when I was hitting that crossroads, and I took a really good right turn to just taking it to another level. But I think to go back to your question, because I'm digressing here, is definitely the educational piece. So the medical history portion, the doing your assessments and making your patient part of that, right? When we're doing periodontal charting, they think we're just poking them because we don't take the time to explain what we're doing. So if we have the ability to use a voice activated periodontal system, or you can even turn on your voice note on your watch and start recording as you're calling those numbers out and transcribe it later if you don't have that. Or if you have a dental assistant or someone come into the operatory and record it for you, old school, but explaining to the patient what you're doing before you start. Mr. Jones, I'm going to take a periodontal assessment. What that means is I'm going to be measuring 6 points around every tooth, not only to see how firm and tight your gums are around the tooth, because that helps me understand how healthy or unhealthy your gums are, but I'm also going to be looking to see if you have any gum recession, if any teeth are loose, or if we've lost any bone in between the roots of some of your molar areas. You're going to be hearing me calling out these numbers. You're going to hear me saying things like furcation grade or recession. Those are things that are a little bit more advanced, and we'll discuss that more once I'm done. But what you don't want to hear me say is bleeding, because bleeding means we have active disease and the barrier of your gum tissue has been wounded and broken down. And now the bacteria in your mouth is able to enter your bloodstream. So if we do have some of that, we're going to talk about how we can reduce it and eventually hopefully eliminate it. But those are the things that you're going to be listening for as I'm doing this assessment. Do you have any questions for me? I'm usually like, no. But then as I'm doing it, they're responding. So now this is part of my communication to them. I'm already telling a story as I'm doing an assessment. So like Dr. David said before, we all have 24 hours in a day. We have to choose to work smarter, not harder. And I think that if we can take a couple minutes to just explain a little bit more thoroughly to our patients what we're doing, we can get those magic minutes back later. And then I disclose my patients. And that is so powerful because now the data I have radiographically and the data that I have from the periodontal charting, which they're already like, oh gosh, I heard you say bleeding a whole bunch of times. And my program luckily spits out for me a report and I have, boom, right there, the bleeding percentage, and it stages and grades my patient for me based on the data that I put into it. So I can adjust it if I don't agree, but the AI is helping me expedite my workflow. And I give them the results of what we found. And then when we disclose everything, it reinforces the why. So, like, you have inflammation here because look at this bacteria we found during this bacterial analysis. This is showing us that you have bacteria here that's more than 48 hours old. That's been sitting there for 2 days, and your brush and floss has not touched this area. So, the whole key to this is the better you disrupt this bacteria and the less mature it is, the healthier your gums can be and the less bleeding points we're going to see. We want to reduce the risk of that bacteria getting into your bloodstream because it's associated with other problems systemically. And we talked about how you have a family history of a heart condition or whatever their medical history presents, bringing that back in so they understand that risk factor associated. So I spend the bulk of my appointment in steps 1, 2, and 3. There's sometimes that I'm like 30 to 40 minutes into the appointment and I'm just now picking up my airflow and getting to work. But I can trust that process because I know it's only going to take me, if I'm on a maintenance case, I could be done debriding in 10, 15 minutes tops because I have this advanced technology that's going to allow me to do a very comprehensive treatment in a very minimal amount of time. So education is everything.
I love that. Okay, so the three of us understand how framing a conversation really well sets us up for success, and we can connect it to the technology like you're mentioning. But I'm going to think like a dentist or hygienist that maybe doesn't understand what the three of us think. But don't my patients feel like, wow, they only spent 15 minutes cleaning my teeth. What am I really paying for? Like, what do you say to them to help them understand what we understand?
Yeah, that's a great question. So I always just have my patients say, hey, how does your mouth feel when we're done? And I give them that mirror and I show them, and their teeth have never been whiter and brighter. They remark that it has never been more comfortable. And they also remark that their teeth have never felt cleaner before. When I transitioned from doing traditional hygiene to GBT, I was the only hygienist in the practice. So I saw all the patients at that time. And they would start saying to me, as I got better at my piezon technique, because nobody taught me how to do it, I had to figure it out myself. And it was a transition. And as I got better at it, they would say, Melissa, you always worked so hard to make me comfortable, but since you started doing it this way, it feels so much better than it ever did. And I love that you don't have to do as much scraping. And oh, by the way, I always hated that polish, but I didn't want to tell you that.
Mm.
So like they would just openly remark about the change. And then the fun thing is, I'm humble enough to admit this, is that I started seeing black chunks of calculus coming out. Again, I was the only hygienist there. But as I got better at that technique, I could adapt and reach areas with this technology that I couldn't with my previous technology. So, and I started seeing pinker, firmer tissue. I started to see patients with less biofilm at subsequent appointments, even though they might not have really been great or made any of those behavior mods at home. I still was managing biofilm more comprehensively with this protocol than I was previously. So the regrowth and the repopulation process was slower because I was able to get more biofilm out with this. So there was a lot of just anecdotal things that I had noticed throughout the way with this transition with my patients.
The other thing I think that we do, and I know I did it too, I was so scared. I literally heard about GBT and I sort of jumped in with both feet, kind of expecting it might end up in a closet, or that patients would be offended along the way because I think
Yes.
disclosing, like as a dental professional, I'm just imagining like my super like I don't know, my like rich snobby patients being like pissed that their teeth are painted purple, like the whole thing. People are actually amazing. and they want to know what's going on for their health, and they want to be healthy, especially when, and this is totally anecdotal, this is 100% my opinion, so take it with what you want to say, but I believe that everybody either has themselves or is related to somebody that has a systemic illness that's exacerbated by oral biofilm. And
Hmm.
so I would, there's always a place where they're interested. And, I feel like I was worried about the insurance reimbursements and all that. And, patients, it's so funny. My hygienists are like, you're just seeing me. You don't have to see the doctor. It's, you're just paying for like the visit with me. And they're like, oh, well, how much is that? They're expecting this crazy number. And then my hygienist is like, no, it's just this. Like they make it like the fee is like no big deal. And they're like, oh yeah, okay, yeah, sure. I can come every 3 months. And it all of like we had to give them a chance. Like I feel like before it was like, no, 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 if insurance doesn't cover it, we should probably back off. But the reality is that's not what the science supports. And our
Right.
patients weren't healthy. And so I
Right.
feel like nowadays, you mentioned the patient with two bleeding points. My patients beat themselves up if they have two bleeding points. And that we wouldn't even acknowledge it back in the day. Be like, "Oh, you look
Hmm.
great." Whereas now they're like, "I can't believe I have two. I'm coming back with zero next time." And
Yep.
it's just such an amazing, satisfying, rewarding, incredible thing to experience. So I think, hygienists that are like, oh, I don't know, like we really truly can make a difference in our patients' health. And I feel like they value us more. I think we are part of the reason that we were not important enough to see patients during COVID. I think, we can take some responsibility for that, but I think the tides are turning and I think it's pretty exciting.
I,
Absolutely.
I like to, Melissa, what you said earlier is, we've been talking about the oral systemic link for, forever in
Forever.
dentistry, but you're actually making a real connection to it. So to have the conversation about, oh, the mouth is connected to the body is great. That's a start, but to actually dive deep and share with your patients how, where, and this is the impact of what's going to happen in this room today. Um, because I'll tell you what, like I'm petrified of Alzheimer's. Petrified. Like to me, that's the worst disease I could ever get.
Hmm.
And so the fact that we, can be a part of a solution and keeping our patients safe is incredible to me. But I think to your point, like we've got to get into the weeds with our patients and they need to really understand what oral systemic connection means, not just this like flighty thing we've thrown out in dentistry and not really done anything with.
Yeah, no, I agree. And that's why I'm kind of taking the approach of what is, I'm calling it oral biohacking. I mean, I didn't make that term up by any means, but there's this whole biohacking movement that's going on out there. And if you look at the trends, the wellness industry is projected to be like in the trillions. It's just skyrocketing because what you guys both said, patients now are more aware of how their health is connected, like taking charge of their health and doing the things to make sure that their wellness is optimized. So we have such an important role to be able to share with our patients that your health is not optimized if you don't have good oral health. And gut, we all know digestion starts in the mouth. It's one of the first things we learn in dentistry, right? So how could a patient have good gut health if we have periodontal disease? Or if we have a mouthful of cavities, we have a bacterial imbalance. And we have to try to shift that oral microbiome from dysbiosis to symbiosis. And then we can start to see all the changes that are going to happen in your total body health as a result of that. And they don't even know, right? But I think it was Casey Hine that I learned from that said periodontal disease is a medical disease with a dental therapy. And we this is where we need to be. Like this is what we need to be doing. And that's why it saddens me that yes, we have a dental hygiene shortage, and yes, we have to meet our patients' needs, but supragingival scaling isn't the answer.
Mm.
Flicking calculus off is not the answer. Polishing teeth is not the answer. It's treating inflammation and oral biofilm. So, I mean, we need to do something differently. I would love to know what you guys as practice owners are thinking in that regard. Like, we do have people out there that want to provide this level of care. How do we match these people together? Because I hear dentists saying to me like, "Hey, Melissa, I can't find a great hygienist. I'd love a great hygienist, but I can't find one." And then I hear hygienists saying to me, "I want to do all the things you're talking about, but I can't find a dentist who's going to partner with me on that." So like, how do we fix that? How do we get these people together?
I can't fix it on the hygiene side, but I can promise you, if you've got hygienists out there who want that dentist, I can introduce them to that dentist in any city in America.
Absolutely. But I also think that we need to stop considering our team as staff, as our
Mhm.
team as the girls in the office. Stop calling your office administrators a desk. They're not a desk, like, and
Amen.
stop, like, honestly, we have to, you know, utilize our team as the professionals that they are. If they're not professionals and you kind of want to lump them in this, like, plop them in this thing of people that are just kind of people that work for you, then, it's just, you're never going to do this, and I feel like it really comes down to empowerment and autonomy. And, yes, we can lead without micromanaging. We can stay in our lane and also elevate the people around us. And everybody wins in that way. So, oh my God, I could be on this soapbox for a definite minute, and we don't have
Forever.
we sadly don't have the time to do that. And I feel like every
Mhm.
little topic we touched on could have been its own podcast. So, Melissa, you're going to have to come back, like you just have
Mhm.
to. But in the
I would love
meantime,
to.
would you share where people can find you, follow you, ask you questions, etc.?
Sure, absolutely. So my Instagram handle is it's the badass hygienist. And I would love for you to follow me there. I post a lot of what I've got going on that page. I'm on LinkedIn as Melissa A. Obrotka, and my Facebook is also It's the Badass Hygienist, and same on TikTok. Although I was just community banned on there for using music, so I don't know how much of my stuff is going there right now. So yeah, that's basically the best way to get in touch with me. If you shoot me a DM on Instagram, I'd be probably most responsive there. My website is it's the badasshygienist.com. So I have a blog I put out weekly that is kind of hitting all the topics we discussed. I kind of rotate through those oral systemic things and just trying to empower dental hygienists to really raise the bar and practice at the top of your scope. You learned all that stuff for a reason. Let's go out there and utilize it, right? If we're bored, let's see what we can do. Take a look in the mirror, see what we can do to change that. And sometimes it's just going and talking to your doctor. I'm sure docs like you would love if your hygienist knocked on your office door and said, "Hey, can we have a chat for a minute? Because I'm feeling this way, and I would really love to put our heads together and see how I could kind of take a turn and do something different." So, don't be afraid. Don't think, again, just like we don't want to opt our patients out for care, don't opt yourself out, and have conversations and talk about it and try and see where that gets you. Keep educating yourself, be a lifelong learner, because that's the biggest thing. We all took an oath to do that. So keep on learning. I'll keep sharing what I'm learning because I'm a giant nerd and I'm going to keep on doing it. And I'd love for you to reach out to me and join me along the way.
Awesome. I just followed you. And
Thank
if you
you.
remember, please DM me. I have a wellness television show that I know the host really well, and I want to talk to you because you need to be on that show. I can get you on that show. And friends, thanks for
Amazing.
hanging out with us this week. Pam,
Thanks for having me.
Oh my gosh, this was such a wonderful episode. Thank you for joining us, everybody, and we will see all of you next week on Dentistry Unmasked.
Thank you, everyone, for watching or listening to the show this week. And thanks to our guests and sponsors on this episode.
Please check out our social media at Dr. Pamela_Maragliano and at Dental Economics Official.
Or you can check me out at Ignite DDS or at Dr. David Rice.
And go to dentaleconomics.com to receive dental economics. You can choose to receive DE in print or digitally, and you can also get the details of our Principles of Practice Management conference on our website.
If you have topics or guests or anything you'd like to talk about on the show, send us an email to dentistryunmaskedpodcast@gmail.com, and we will do our very best to make it happen. Thanks again, and we'll see you next week.